going to introduce to you the corresponding design response I made for the mental health issue of the Bago community. Bago is one of Australia's most isolated desert settlements in the Kimberley region of Western Australia. The community is located between two deserts, on the northern edge of the Great Sand Desert and the western edge of the Tarnami Desert. In this area, the suicide issue of young Aboriginals is a growing and long-term problem. According to the report published in the Medical Journal of Australia 2016, the suicide rate among Indigenous people in the Kimberley area, which Bago belongs to, was 7 times that of other regions of Australia, and it is one of the communities with the most serious suicides in 2020. Based on my research, the main influencing factors that cause the mental health issue of the Indigenous people in the Bago community to be much higher than those in other areas can be summarized as 4 aspects: self, social, cultural, and political. Among them, I believe that the first thing that should be addressed is the lack of awareness of the Indigenous people to seek mental health consultation and help, as well as the insufficient publicity of the prevention of mental health issues. In terms of the theoretical framework used in my design response, according to From Public Health 2017, social and emotional well-being is a key determinant of Australian Aboriginal health outcomes. However, the results of research on the health screening for Indigenous SCWB conducted by Frontier Public Health 2017, the best practice for screening SCWB in Indigenous health lacks clear model of guidelines, which may lead to wide difference in the provision of SCWB service. This shows that a publicity guide is necessary to promote the awareness and convenience of SCW screening for Indigenous people and to provide assistance information. Thus, my design response is a brochure which aims to helping Indigenous people in the Bago community actively participate in mental health screening and effectively seek treatment assistance, so as to prevent and reduce the occurrence of Indigenous self-harm or suicide. The principle of this brochure is based on the combination of social and emotional well-being and cognitive behavioral therapy. According to Zurich 2014, factors that have been identified as enhancing SCW including maintaining contact with the nation, spirit, lineage, and kinship network, as well as strong community governance and cultural continuity. One of the principles of CBT is to teach patients to recognize, evaluate, and respond to their dysfunctional thoughts and beliefs. And here are some laid out planning of my brochure design. According to the concept of effective promotion of SCWB in the design framework, it is necessary to maintain the continuity of Indigenous people and nation spirituality and culture. So my brochure design style is inspired by one of the artworks from related artists which located in Bago. It is one of Australia's leading Indigenous art centers. The use of the color palette is also inspired by this artwork. I use irregular line segments and the most representative dark elements in Aboriginal art to design a pattern like the sun, symbolizing hope and light. And another design pattern is based on the combination of wave graphics and dot elements in the artwork as well. According to the overall design framework summarized, the contents of my brochure is divided into several sections. The first section is to introduce what is mental health and promote the importance of prevent mental health problems. The second section is to provide self-test survey and evaluation, as well as action suggestions corresponding to each test result. This aims to help and teach patients to identify or elevate their own dysfunctional thoughts and beliefs, such as anxiety and depression. And then the third session is to provide a detailed introduction and information about the institutions and organizations that are providing mental health service to the Bago community, such as the types of survey provided, consultation telephone numbers, address, and so on. To help indigenous people in need quickly and find their own counseling or treatment approaches. The final session is providing some tips and advice on how to improve life happiness, relieve psychological pressure, etc. After my experiments and tests on a series of printing papers, the printing material I use in my final brochure is a kind of glossy paper. I believe that the printed texture of this glossy paper can be better reflect the overall visual effect than matte paper. Regarding how to effectively deliver the brochure to the indigenous people in the Bago community, I think that by contacting community managers, they can distribute it to each household to ensure that it can be fully promoted within the community, or set up a distribution site in the community so that indigenous people can receive and read freely. And this is a simple short video showing how the brochure works. This is the end of my presentation. Thank you for listening.